Horizon TV, the beacon for the nation.
This program is suitable for general viewing.
Assalamu alaikum wa rahmatullahi wa barakatuh. It is 17th of May 2024. A very good morning to you and welcome to Horizon TV. My name is Zamzam Ahmed and this is the Muslim Insight. So much has been going on throughout the week and I am here to share with you what has happened throughout the week. But before that, let's get to the headlines.
The damage that these floods have caused in terms of our infrastructure is up to 80 billion.
Flood situation. More than 277 Kenyans have lost their lives with more than 60 health facilities affected by floods.
Today in total we've received 40 tons that is actually has come with this flight.
A friend in need. Indian Air Force airlifts humanitarian assistance and disaster relief items to Kenya following severe floods.
The best way to make a girl to abstain from premarital sex is not by cutting her genital, but by educating and mentoring her.
Ending violence against girls. FGM survivors calls for collaborative action to ending violence against girls.
Thank you so much for keeping it at Horizon TV. My sign language interpreter is Mariam Jamaluddin. Now on to our story that has reached our news desk is that selection panel for work for commission has been sworn in. Still following up on that story. Moving on to our top story is that more than 290 Kenyans have lost their lives with more than 60 health facilities in 11 counties affected by floods. In a press statement, government spokesperson Dr. Isaac Moura said the government is working around the clock to ensure the safety of Kenyans with multi-agency teams working to ensure repairs of the affected infrastructures in the country.
According to the report by the government spokesperson, this week the most affected areas by floods include Tana River, Garissa, Lamu and Narok counties.
The damage that these floods have caused in terms of our infrastructure is up to 80 billion. And that could only be mostly on roads alone.
Speaking to the media at Nyai House, Nairobi, Dr. Moura said the government continues to provide food and non-food items to the affected areas in Busia, Homa Bay, Kisumu, Machakos, Makueni, Tana River, Kilifi, Nakuru, Turkana, Isiolo, Migori, Kajiado, Nairobi, Nyandarua, Kiambu, and Murang'a counties.
Food is still being distributed. There is, however, need for more food, medical kits, non-food items to affected counties, and where search and rescue operations are still ongoing, including Narok, West Pokot, Nyeri, Siaya, and Kenyaga counties.
The Kenya Defence Forces are actively engaged in the Mayu Nakuru County with efforts to clear the roads to ease traffic flow ongoing following the mudslides that left death and destruction.
Still, we have the KDF members in Mayu, 151 of them. The search and rescue is still going on. Remember, of the unaccounted for people, Mayu is still, leading, and it's quite something.
The government, through the State Department for Public, is undertaking demolition and unsafe structures in Kirinyaga, Kiambu, and Nairobi counties following reports that human activities have obstructed the waterways and altered the courses of the rivers.
Accordingly, all persons residing within the 30-meter riparian corridor of rivers and other water courses across the country, especially here in Nairobi, the rivers of Nairobi, Ngong and Mathare are the most affected, have been ordered to vacate for their safety. Mandatory evacuation along rivers in Nairobi counties, again Mathare, Ngong, and Nairobi, is also ongoing, with the government facilitating logistical support, temporary accommodation, and essential supplies to those affected.
Over 50 cases of cholera have been reported so far, with the Ministry of Health in collaboration with the Kenya Red Cross conducting medical outreach programs for cholera control and other waterborne diseases in Tana River and Marsabit counties. Reporting for the Muslim Insight, my name is Naima Juma.
Indeed, a very sad story to hear that so much lives have been lost, others displaced, health facilities destroyed because of the floods. Moving to the next story is that the government of India is providing humanitarian aid to Kenya following severe floods that have devastated the country. On Tuesday, Kenya received 40 tons of humanitarian assistance and disaster relief items from India that will go along the way in assisting those affected by the ongoing floods. Speaking at the military hangar in Embakasi, Nairobi, government spokesperson Dr. Isaac Mwaura said the consignment will be distributed to the 187 camps set up across 25 counties.
India joined other international partners who have sent their support to Kenya due to the ongoing floods in the country.
We've also received 74 tons of food items from the UAE, using the airplanes, which were received last week, also two plane loads. And the UK government has also provided Kenya shillings 140 million in this regard. Also, UNICEF is supporting 6,900 households, all together.
The floods have impacted more than 15 counties in the country, killing over 289 people and displacing over 280,000 individuals.
The total number of health facilities damaged stand at 62 in 11 counties, while the damages on agriculture spans to 168,092 acres of land, 168,092 acres of land, with approximately 8,722 livestock reportedly dead.
An Indian Air Force plane airlifted the relief consignment consisting of tents, sleeping bags, blankets, power generator sets, ready-to-eat meals and hygiene kits to offer immediate support to the affected population.
Today in total we've received 40 tons that is actually has come with this flight, but we also received 2.5 that came through the ship in Mombasa, and we are pre-positioning these items in both Mombasa and Nairobi.
Additionally, the consignment contains 18 tons of medical aid, including essential life-saving drugs and surgical equipments needed for critical care and wound management.
This consignment includes a wide array of essential items such as food materials, milk powder, tents, sleeping bags, blankets, water purification kits, medicines, medical equipment, and medical disposables.
This is the second consignment of humanitarian aid from India after the Indian naval ship arrived in Mombasa with immediate relief supplies.
We are responding to a call made by the government of Kenya and by the Honorable Deputy President of Kenya last week for support from international partners. We believe that this is something that attests to the time-tested friendship between our two countries, and that people are the bedrock of our long historical friendship.
According to the government, the flooding is expected to continue in low-lying areas, riparian areas and urban areas.
Lake Victoria and Baringo are projected to continue causing backflow and flooding of counties in the Lake Victoria and Lake Baringo basins.
Over 1,900 schools have been affected by the floods. Reporting for the Muslim Insight, my name is Aban Shehemi.
Thank you, Aban, for that report. Elsewhere, Al Khair Foundation has distributed 1,000 packages of essential food and non-food items to 1,000 families grappling with the aftermath of the floods in Mororo in Tana River County. With a steadfast commitment to humanitarian aid, the foundation swiftly mobilized resources to alleviate the plight of those hardest hit by the calamity.
In the midst of devastation caused by the relentless floods in Mororo, Tana River County, Al Khair Foundation has stepped up to extend a lifeline to the distressed community.
Sisi kama shirika na mashirika mengine tumekuja pamoja ili kuweza kusaidia familia kama hizi waweze kupata lishe, waweze kupata pia madawa na vile mambo ambayo kwamba yanahitajika.
Speaking during the distribution process, Suleiman Musa, the project coordinator of Al Khair Foundation, emphasized the ongoing commitment to stand in solidarity with the impacted communities throughout their time of need.
Ile 1,000 itaweza kufaidika, tumewaletea chakula ambayo kwamba ni bora zaidi, especially kwa watoto, inaitwa Nutrimix ambayo kwamba itaweza kusaidia kwa haraka kuwapatia recovery wale ambao kwamba kwa wagonjwa. Pia vile tumekuja na mosquito net kwa sababu maji imetuzunguka kila mahali vile unavyoona, na vile tuko na water purification tablets ambayo kwamba inafanya yale maji yawe safi tusiweze kupata madhara na magonjwa zaidi.
As the community in Mororo struggles to recover from the disastrous floods, the call for government interventions grows louder. Many beneficiaries lament the absence of support from both national and county authorities.
Wamekuwa wagonjwa kwa sababu ya mvua. Ukiingia hapa ndani utalia wengi sahi kama wengi sahi kwa general na watoto kwa sababu ya mvua, kwa sababu ya baridi na njaa. Na nafikiri hata tunashangaa kwa sababu Kenya mzima tunaona misaada inaenda, lakini kutoka Tana River sisi ni watu wa Northeastern, tuko hapa, watu wanatusaidia, majirani yetu ndio wanatusaidia, lakini wale wanatakana watusaidie tuwaone.
Serikali atusaidie chakula, choo, maji, dawa, mgonjo. Mvua inanyesha, hatuna mahema, hatuna tarbala. Tunaweka manguo kidogo, ile manguo kidogo mimi nashika na kimbia naye, tunaweka juu. Mvua kinyesha, atanyeshea sisi.
The aid packages include fortified flour to address malnutrition concerns, mosquito nets to combat the risk of vector-borne diseases, collapsible jerrycans for storing clean water, and water purification tablets to prevent waterborne illnesses. Apart from meeting the immediate needs, the supplies also laid the groundwork for long-term resilience in the face of ongoing challenges. Reporting for Muslim Insight, my name is Shadia Ramadan.
Still on matters of flood and humanitarian aid is that the Orange Democratic Movement Party distributed food and non-food items to the residents of Mathare affected by the floods. The donations were done under the ODM Disaster Response Committee, which was formed as part of their response to the current national flooding crisis. The flood crisis in the country continues to worsen. Interior Cabinet Secretary Professor Kithure Kindiki said that the government has set up 187 camps across 22 counties, hosting over 70,000 affected people.
We have been very concerned with the kind of lack of dignity that our people have been subjected to by the ongoing floods and the disaster crisis that we are seeing in the country. So as a party, we deem it fit to come up with an initiative to stand with Kenyans and be able to support where we can. We do recognize as a party that initiatives that are geared towards charitable actions are limited and therefore sometimes sustaining them are difficult. But we want to be very grateful for the people who have been able to support us to get some form of aid that today marks the day when we are going to start distributing and supporting different families. We made appeal for non-food and food items, and the response has been amazing.
As we speak, the rains may have stopped in Nairobi and it is looking bright and shiny, but in terms of the displacement situation around the country, we still have quite a number of families in displacement camps. And these are families who are in need of your support, in need of urgent medication, in need of food, in need of other forms of support, including shelter. We've also had a discussion with the ODM leadership around what are the mechanisms we can use to support early recovery and permanent recovery, especially in form of shelter to the affected population.
We have not come here for politics, as said before by my colleagues. We are here to help everybody that is affected. When we go to Mathare, we will not be looking at this is an ODM supporter, this is an ODM supporter. We are going to help people who are affected as much as we can in our own capabilities.
In other story, religious leaders from North Rift region have raised concerns regarding the new taxes proposed in the Finance Bill 2024. The leaders, led by Council of Imams and Preachers of Kenya CIPK North Rift Chairman Abubakar Bini, said the government should not burden the common mwananchi with new taxes, but instead should work to alleviate their suffering due to high cost of living.
Tunawaambia wabunge wawajibike, wasome mswada vizuri, mapendekezo vizuri, wajaribu kuona namna gani watamsaidia mwananchi. Mzigo umekuwa mkubwa kwa mwananchi, hasa katika pendekezo lililopendekezwa kwa kuwa mkate utaongezwa kodi ya shilingi 16. Ni kumaanisha mkate yule wa Njiko alikuwa kinunua shilingi 60 itakuwa ni 76 ama 74. Hili ni kumwangamiza Wanjiku. Hiki ni chakula cha chini sana ambacho ni kila mtu anatumia.
Kuna watu wanakula only one meal, ambapo binadamu kawaida anataka ale meal 3. Kwa hivyo ikiwa huyu hasla utaweza kumweka kwenye tight corner, hata sio Swahili sema hata yule paka ukimtia kwa rumu ukimchapa tu anakuzungukia na kwa kama chui. Kwa hivyo na huyu mwananchi tukiweza kumkazia maisha yake, wakiweza kutukazia sisi kama wananchi na sisi kama viongozi wa kidini letu kubwa our coexist ni kuweka peace and security. Kwa hivyo na peace security moja inakuja ni kurahisisha chakula kuwa ni very cheap na kwa availability inakuwa rahisi. Lakini chakula ikiwa ghali, basi na maisha pia inakuwa ni hali ya juu na inakuwa ni ngumu kwetu.
Kenya joined 142 other countries who voted for the Palestinians' full membership to the United Nations. According to Foreign Affairs Principal Secretary Korir Sing'oei, the move is inconsistent to the country's historical vote on the matter. The United States and Israel were among the 9 states that voted against the resolution.
The 193-member General Assembly adopted a resolution giving Palestinians additional rights and privileges. The resolution does not give Palestine full UN membership, but recognizes it as qualified to join the world's most powerful diplomatic and political organ. Kenya's permanent representative to the United Nations Ambassador Martin Kimani told the Assembly that Kenya fully supports Palestinians' rights to self-determination and urged the Security Council to reconsider the application as soon as possible. In the Eastern Africa region, Rwanda, Uganda, Burundi, Ethiopia and Djibouti voted in support of Palestine. The Israeli army has expanded its military operations in Rafah in the southern Gaza Strip amid intensified airstrikes. The Palestinian death toll from Israel's ongoing attacks on the Gaza Strip since last year October has surged to 35,000 according to the Ministry of Health. At least 78,000 others have been injured in the onslaught. For more than 7 months now, Tel Aviv has imposed a crippling blockade on the Palestinian enclave, leaving its entire population on the verge of starvation. Salma Salim, The Muslim Insight.
Moving on to other story is that Bright Society Initiative on Friday held a Survivors of Female Genital Mutilation Empowerment and Mentorship Summit in Nairobi, held under the theme FGM happened to us but not our daughters. The mentorship summit aimed to inspire action towards eradicating FGM in the country.
Female genital mutilation is internationally recognized as a violation of human rights. Speaking during the event, survivors shared their stories of pain, survival, and ultimately triumph as they continue to fight the harmful culture of FGM.
I was forced to be circumcised for me to preach to men. Niliambiwa, if you want to be a pastor, that you stand before men, you must be circumcised. And so I went through circumcision mentally. Nilipelekwa mpaka kule, but nikafaulu kutoroka. Pigia mimi makofi. But I saw the procedure and I know everything that women went through.
Their voices echoed their determination as they called for concerted efforts to end the practice that has inflicted physical and emotional scars on countless women and girls.
Mama akipona, nyumba imepona. Na jamii imepona. Na inji imepona.
If my daughter is 17 years and she's not cut, then what do you learn from there? That we are saying no to FGM.
There's an ayah that says that we are created in the best. In the best. Fi ahsan taqwim. And nobody is allowed to mutilate or to harm or to do anything. And what does FGM do? It mutilates our bodies. It harms us. It affects us mentally. And that is the one thing that we are saying no to FGM.
Representing different counties, the survivors recounted their journey from being victims to advocates, emphasizing the critical role of mentorship in empowering survivors to reclaim their lives.
The best way to make a girl to abstain from premarital sex is not by cutting her genital, but by educating and mentoring her.
And then it's good that the health department has also captured FGM as part of gender-based violence, and it's being reported. So FGM is classified as GBV, and it is true it is gender-based violence because it is violence against a woman.
The summit served as a platform for survivors to not only share their experiences, but also to strategize on effective ways to combat FGM.
In our community, we are having ladies who do this job because it is an income-generating activities for them. Could we discourage them at least, so that at least we can empower them and give them something small, so that they cannot look for something that is going to at least discourage them, like kind of small stipend to be paid to them, so that at least they cannot do that. Integrate these into gender transformative, especially in the programs that are done in the schools. We empower religious leaders, especially the imams.
Since FGM was banned in Kenya in 2011, the county has made significant strides in reducing the practice.
FGM tutakomesha.
The 2022 Kenya Demographic and Health Survey shows a decline in FGM prevalence, with the rate dropping to 15% in 2022 from 21% in 2014.
Hatujui ni nini munafanyiana.
This downward trend can be attributed to improved legal and policy frameworks, high-level political commitment at the presidential level, county leadership, and enhanced monitoring by the county anti-FGM steering committees. Reporting for Muslim Insight, my name is Mariam Sa.
Elsewhere in the coastal region is that in a move to curb juvenile gangs and protect children from drugs and drug abuse, Mombasa County Governor Abdul Somad Nasir has directed Education Department to delineate all the schools in the county and the business around the schools. Speaking during the launch of the computing curriculum at Khadija Primary in Kisauni Sub-County, the governor issued a stern warning to all those selling drugs at the school premises to stop the business. With these measures in place, the Mombasa County government hopes to provide a safer environment for children while also addressing the long-standing issue of drug misuse in the community.
Shule zetu zote, public and private schools, secondary, primary and ECD, hakuna mtu yoyote atakayekuruhusiwa kuuza miraa ama mogokaa nje ya shule zetu. Mwataka kawauzieni watu wazima katika sehemu nyingine. Mtoto ikiwa ana miaka 16, 17, akiwa anapata kitu cha shilingi 20 na kinamlewesha, kinamharibu akili, kinamfanya sasa aanze kupelekana na walimu speed na wazazi speed, hapo sasa itabidi niwaekee speed gear, na atakayeweka ile speed gear mimi ni gavana. Ile speed governor nitaiweka mimi sasa. Haya mambo ambayo kwamba yalioko, kwa hivyo na mimi najua hata mimi katika ofisi yangu kuna watu wenye kula miraa. Hata mimi katika familia yangu kuna watu wenye kula miraa. Mimi sina shida, lakini wewe ni mtu mzima, una akili yako. Lakini sasa unachukua mtoto mdogo unamharibu na mogokaa, surely. Hata wewe, mimi nauliza wale wenye kufanya biashara hii, nyinyi mko radhi kweli watoto wenu waharibike? Tunapata watu wanaanza kuokota makaratasi kisa na sababu aliipata starehe, aliipata wapi? Mzazi anatoa pesa, anajua kwa mtoto anaenda kununua viazi na vitu vingine vya nini, kumbe mtoto anaenda kutafuta mogoka na tena inauzwa nje ya shule. No, we will not have that.
Now on to our last story is that renowned Sudanese fashion designer Ghada El Shazali, in collaboration with Uzuri Jewelry, held a Sudanese fashion show off James Gishuru Road in Nairobi, aimed at promoting the culture and style of Sudanese Muslim women. Speaking about the inspiration behind the showcase, Ghada El Shazali emphasized the importance of celebrating Sudanese culture on a global stage. The fashion show was used to showcase and highlight the beauty and diversity of Sudanese Muslim women's clothing, while also showcasing the talent of Sudanese designers. The fashion show was attended by high-profile Muslim women leaders in the country. Now that story brings us to the end of our first segment of the Muslim Insight. Prepare for the next conversation because we are going to have a guest and on matters of flood, sustainability of the community. What has the organization or what have you as an individual done to help those in need during this time of flood? Stay tuned.
Horizon TV, the beacon for the nation.
Kuna faida gani twapata tukimjua Mtume sallallahu alaihi wasallam,
nabii mwenye ushawishi mkubwa duniani?
Tukizikwa tukitiwa kaburini, tutaulizwa haya maswali matatu: man rabbuk, ma dinuk, man nabiyuk.
Sheikh Jamaluddin anakupa simulizi.
Huwezi kumpenda mtu usiyemjua
na kutambua sunna zake,
lakini ukimjua na ukimtambua Mtume Muhammad sallallahu alaihi wasallam, mapenzi yako yatazidi.
Ufahamu Rasulullah, familia na maswahaba wake. Tazama sira ya Mtume kila Jumatatu saa 1 jioni kwenye Horizon TV.
أعوذ بالله من الشيطان الرجيم. يا أيها الذين آمنوا إذا نودي للصلاة من يوم الجمعة فاسعوا إلى ذكر الله وذروا البيع ذلكم خير لكم إن كنتم تعلمون.
Enyi mlioamini, munapoitwa kuhudhuria swala ya Ijumaa, fanyeni haraka kuikimbilia, muache biashara zenu, hilo ni bora ikiwa mwelewa.
Isikilizeni kwa umakinifu khutba ya Ijumaa
ili uzidi kujenga imani yako na kupata faida nyingi ya siku hii.
Coming to you every Friday from Jamia Mosque, Nairobi.
Live on Horizon TV.
Verse of the day.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم
يا أيها الذين آمنوا لا يسخر قوم من قوم عسى أن يكونوا خيرا منهم ولا نساء من نساء عسى أن يكن خيرا منهن ولا تلمزوا أنفسكم ولا تنابزوا بالألقاب بئس الاسم الفسوق بعد الإيمان ومن لم يتب فأولئك هم الظالمون.
Horizon TV, the beacon for the nation.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back and thank you so much for keeping it at Horizon TV. This is our second segment whereby we engage ourselves in conversation. And today we are going to talk about sustainable community solutions. To discuss matters on that sustainability of the community, then I have two guests of mine. On my left-hand side, we have Dr. Benjamin Nyilitia, Chief Science Officer for Life Solutions. And also we have Solomon Mwaniki, WASH and Public Health Emergencies Technical Coordinator. Good morning.
Good morning to you.
How are you doing today?
We are doing well.
Welcome to Horizon TV.
Thank you very much.
Thank you.
So since we are talking about sustainable community solutions, we've seen the work you guys are doing towards community, towards helping the community that have been affected by the floods in terms of giving them clean and safe drinking water. Now on to that, because Dr. Benjamin, you are the Chief Science Officer for Life Solution. Maybe could you tell us what For Life Solution is and what you guys do?
Okay, thank you. And thank you, listeners. It is great to be in this show, especially to identify with matters concerning the flooding situation which has come upon our nation at a time like this. For Life Solutions is a limited company which is based here in Kenya, but it has roots in Denmark. We develop cheap and easy to use techniques to treat water, because we understand that especially in developing countries, almost 2 billion people, they lack access to safe water. So our aim is to provide clean water to at least 1 billion people in the world with affordable and cheap systems which they can use to treat their water. And in this respect, we use solar, which is abundant and which especially in Africa and in Kenya in particular, we have a lot of sunlight, so we use sunlight to treat water.
Now, For Life Solution is all about providing safe and clean drinking water. Maybe on AMREF, what does AMREF Health Africa do, and maybe something like that?
Thank you very much. First is to appreciate and thank the station to having welcomed us to have this conversation. AMREF is an international, the largest health development international NGO, headquartered in Kenya, and we are present in 35 countries in Africa. And we have our vision, which is lasting health change for Africa. And we have a mission, which is transforming the community's health through primary health care, which is majorly focusing on women and children, as well as youth, and of course encompassing other social determinants of health. At AMREF, we address all the health, public health issues, ranging from the WASH, the public emergencies, health of women and children and youth, as well as other social determinants of health.
Maybe how does the partnership between For Life Solution and AMREF Health Africa help in navigating or curbing the challenges that people are facing due to floods, in terms of distributing the sour bags that you guys have done in collaboration with the For Life Solution, and specific challenges of providing safe drinking waters to the community? Dr. Benjamin.
Yeah, thank you for that. Yeah, we understand the current situation, and through our partnership with AMREF Health Africa, For Life Solutions has donated 1,000 sour bags. And let me shortly describe what these sour bags are, because these are bags which are made of special plastic material, which when you put your water, which may be contaminated with bacteria, and bacteria, we mean bacteria which causes cholera, diarrhea, and these other waterborne diseases. And when you put that water and you take it outside your house where there is sunlight, and you allow it to stay for 4 hours, your water will have been disinfected, or all the bacteria and the germs, which that is bacteria, virus and protozoa, will have been killed from the water. So after 4 hours, your water is clean to be used for drinking purposes. So this partnership in the midst of the flooding situation, it is strategic because it addresses the issue of contamination. You know, after flooding, we have latrines, you know, the pit latrines, when they have all mixed with the water, and even sewer system, if they are mixed with the water which people consume, you find that it is waterborne diseases like cholera being reported. So these sour bags will people will use them and be able to treat this water so that the bacteria which is in the water is completely removed, and you find that the sour bags can be used for 1 year. So
maybe on your side as the AMREF Health Africa, how does the partnership work between you and the For Life Solutions in terms of, like, they have distributed 1,000 sour bags. Through them, you've been able to get 1,000 sour bags to distribute to the communities. Maybe how is your partnership working?
Thank you very much. Yeah, AMREF is focusing on making sure that there is continuity of service of the health of the communities. And we know during the flood situations, a lot of infrastructure, water, sanitation, and hygiene facilities have been disrupted, have been destroyed. And there is a possibility that the water that these poor populations are taking is contaminated, and these sour bags are coming handy to make sure that this contaminated water is treated at the point of use at the household, so that the communities, this household, are able to access safe water and be able to make sure that they avoid the outbreaks of the waterborne diseases. And layering on what AMREF has been doing, working with the communities and also through the government, these structures are the ones that we are utilizing to make sure that we reach and distribute these solutions, so that the communities, the structures is utilized, that the system is aware of where the needs are needed most, and these are the people that we are reaching.
Dr. Benjamin, before I cut you short, maybe you've talked about distributing 1,000 bags, and I trust they cost 750,000 Kenya shillings.
Yes.
Maybe do you guys distribute these bags to the communities for them? Are they buying them, or you're distributing them freely?
As a For Life solution, during this time of the flood situation, we have donated 1,000 sour bags to the flood victims. However, because you know the people affected are many, and we are calling upon partners like AMREF has done. We are calling upon more partners to buy from us, so that we can be able to reach these people who have not yet been supplied with these water treatment solutions during this time.
So it is AMREF who are buying from the For Life solutions?
No, we have given for free, okay, as For Life solution. Yes.
And maybe the areas that you are targeting to distribute these sour bags?
Yes, with in this partnership we are targeting the Tana River, which has been highly affected by the flooding situation, and whereby many cholera cases have been reported in the country, and also the Mai Mahiu flood victims. Yes, for this particular donation.
Coming to you, Mr. Solomon, let's talk about water, accessibility, sanitation, and hygiene promotion. We are talking about you guys distributing the sour bags in order to give them clean and safe drinking water. As far as sanitation is concerned and hygiene promotion is also concerned, maybe what's the partnership? What is the plan of the partnership?
Absolutely, thank you very much. AMREF aims in its intervention on resilient and health system strengthening, and in addition to the short-term response to the floods issues, including the water treatment through the sour bags, we are acting in a very integrated manner, where we have been working with the governments and other actors to make sure that other issues of public health is addressed. These include the sanitation aspect, where we are engaging communities through risk communication, and of course directly making sure that the communities are participating in this, so that they get to understand on the preventive and control measures that they can take, so that as we prevent the diseases and control the diseases, at the long run, the communities are well empowered to make sure that they take their own action, as well as ensuring that the health systems are strong and resilient to any crisis in the future.
You've talked about collaboration. Mr. Solomon has talked about collaboration.
Yes.
Maybe on your side, other than the AMREF Health Africa, are you like involving the community or the other partners, other NGOs?
Oh yes, very much. In fact, AMREF is one of our partners, and for your information, we are operating not only in Kenya, but we are operating in the developing world. Our presence, we are in Tanzania, and we have partnered with the Tanzanian Red Cross Society. We are also working with the World Vision in Tanzania, and Catholic Relief Services. We have worked with Catholic Relief Services both in Kenya and in Tanzania, and also we are working with other partners in Uganda, in Southern Sudan, and we have other regional offices even as far as India. So our focus is mainly in the water and sanitation challenges, that is safe water in the developing world.
Now, considering accessibility, community involvement, maybe what's the partnership ensuring that the safe and effective distribution of clean and safe drinking water?
Thank you. Yes, as I had mentioned earlier, we work through the government. We work at all levels with the authorities. We work for the communities, and with the communities being at the center point. This is the people-centered approach of our intervention. And through this, we are able to make sure that the communities are involved. And these partnerships that we are forging and we have been sustaining all this time, they are delivering impactful interventions and outcomes at the community level, so that all the health issues and other social determinants of health are addressed holistically by all the partnerships involved. And specifically during these flood situations in the areas that we have mentioned, we are conducting integrated public health emergency interventions, so that we are able to holistically address the aspect of safe water, safe and appropriate sanitation, improved hygiene, maternal child health interventions, nutrition, immunization as a holistic manner, to make sure that we are ensuring that there is no disruption of any health issue, which is, of course, we know health and water and sanitation, all these are human rights, and we are addressing them holistically in the collaboration that we have already built.
Dr. Benjamin, we are trying to help those affected families, those flood-affected families. Maybe there is a way you guys are, the mechanism of watching the impact of your program. Maybe what's the mechanism you guys are using in order to watch or the project, impact of the project of improving the lives of those affected by the floods?
Yeah, thank you for that. As I began by saying that our products, water treatment products, they last for 1 year at least. That is the sour bag. And we do monitoring from time to time about the adoption of these products by the end users. And we have people who normally from time to time, they visit the areas where we have projects and where our partners have distributed the sour bags. And also we try to collect data. We do interviews with the end users, and we also partner with the government, that is the county government, through the health centers and hospitals, to get data about cases of like diarrhea or cholera, so that we can compare the period before the intervention, that is before supplying the water treatment solutions, and after these people have adopted the use of the sour bags, how are health issues being reported in that community or in that hospital. So we are able to analyze the data from the end users, and also we get data from public health data, so that we can analyze the impact of our interventions to the community.
So in terms of adaptation of the new system of using the sour bags, maybe what are other things you guys are doing? Because wherever you're giving out those sour bags, maybe you're giving to the people from Mashinani.
Yeah.
These people, they don't have any knowledge concerning those sour bags. Maybe what are other things you guys are doing to ensure that they have full knowledge of what you guys are giving them?
Yeah, thank you for that. Yeah, I say that our technology is simple. So first of all, we train our partners like AMREF. We are organizing on training the staff who will be distributing the bags. Together with that, also our team participate in the distribution and also in training. So we train both the partners on how to use the sour bags so that they can train the end users. We also go to the field before we distribute. We train the end users on how to use this system, because it is very simple. It can be understood by even the old, our old grandmothers, because it's a matter of just putting your water in the bag and taking it to the sunlight for treatment.
Okay.
Thank you.
So much story or questions fall under you, but let me just switch a little bit. In terms of the sour bags, maybe other than the sour bags, what are other methods the AMREF Health Africa is using in terms of health-wise in order to assist those affected families? Not only the affected families, because we can see that 59% of the population are really going through tough times in terms of accessing clean water. Maybe what are other things that the AMREF Health Africa is doing?
Thank you very much for that. And AMREF, together in partnership with the government and other authorities and other actors, we are in coordinated structure addressing the flood-affected populations as well as the general population through delivery of integrated health services. And this includes the whole spectrum of wash in terms of improved wash, access and use. Maternal child health interventions, including family planning, including the immunization, because we are there to make sure that there is continuity of services, there is no disruption of the normal health systems. We are there to strengthen the system so that the health of this population is not affected in any way. We are there to respond and fill those gaps. Yes, then at the same time we are doing risk communication at the community engagement, so that we do very purposive and targeted behavior change communication as part of preventive and control measures of any public health negative aspect, so that the community are able to understand and be able to really have knowledge and change attitude towards the preventive part of the health issues. At the same time, we are supporting the health system to intervene in curative measures. These are through the integrated medical outreaches, where we are doing treatments of the diseases. This includes the infectious diseases, non-communicable diseases, so that these communities who have been displaced and their facilities where they have been visiting has been displaced in terms of access, we are able to reach them from where they are. Then on the community aspect, we are empowering them through their structures, through the primary health care, including where we are engaging their own resource persons, that is community health promoters, to ensure that they continue sensitizing the communities on the preventive and the control measures of the diseases and other health issues.
Thank you so much, Mr. Solomon. Now to you, Dr. Benjamin. We're talking about the response you guys are giving towards helping those affected families during this time of floods. Maybe what is your plan? It is flood time, yeah. But once the flood is over, what maybe are your plans, your future plans, in terms of helping, distributing the sour bags, ensuring that the community are not exposed to waterborne diseases?
Yeah, thank you so much for that, because you know, we need to look beyond the flooding situation, because as I said, we have a very ambitious aim or plan to reach 1 billion people with safe water for drinking purposes. So we are expanding our, our sphere of influence within Africa and the other developing world, and we are going into partnership with organizations, international NGOs, so that we can educate our people on the need of using treated water, and also on issues of sanitation. We understand that the challenge of let's say a third of the world population not having access to safe water, it is because of it is an expensive endeavor, and that is why our techniques are very simple, and our technology focuses on those people who are in the low-income communities, people who are living in the slums, in the urban areas, the people who are in the rural areas, so that they can use solar, which is available. The other people, people like here in the city, we use treated water. Yeah, but the water service providers in Nairobi or in the other counties cannot supply all the people in that county or in Nairobi County with safe water. So our focus is that population which is not able to have a tap of treated water in their house. We are targeting the mamas in the village and in the informal settlement to give them a technique which they can afford, because these sour bags are they are cheap, and when you buy one sour bag, it can serve one household for 1 year, and you find that one of the most strong thing about the sour bag, it is that it treats water at the household level. Water can be treated in the tap, but in the process of transferring it from the tap or getting it by a container like a 20-liter jerrycan or 10, there is contamination in the jerrycan. But here, our sour bags, the way they are meant, you find that there is a dispenser, so that after you treat the water, you hang it in your house and you can dispense it directly into the drinking cup. So this is what really we are using, so that we can reach out on this big population which doesn't have access to treated water. Thank you.
Thank you so much. And due to time, I think I'll allow you a bit in a short words, maybe an understanding or lame word. What is your advice towards the community in general?
My advice towards the community is to make sure that during this time and beyond, they use water which is safe, water which has been treated, because we have had reports about cholera outbreak in different parts of the country. And as for life solutions, we have a very simple solution. So we are calling upon partners and also people who come, whom we can partner together, so that we can supply these water treatment solutions, especially to the low-income communities.
Thank you so much. And maybe last chance for you, Solomon Mwaniki, maybe your advice towards the community in general.
Thank you very much. We urge our communities to adhere to the guidelines that have been already disseminated by the government at all levels, so that because all this is for the good of ourselves, and as we align to achieving the sustainable SDG number 6, that is on access to safe water and sanitation, we urge the government and other stakeholders and advocate for resource allocation, mobilizing toward this sector of water and sanitation and hygiene, because modeling has shown that if we retain the current magnitude of resources, it will take us 103 years to access the targets of the SDG number 6. So we urge all of us to put our hearts together in partnership, sustain and be able to have impactful interventions on the communities.
Thank you so much. Thank you for that insightful advice, and thank you also for joining us today and talk about sustainable community solutions. I at least I can see that there is something which is being done towards the community, towards helping the community. Thank you so much. To you, our viewers back at home or wherever you are listening us or watching us from, all I can say right now is health is wealth. Take care of your health as much as you would have taken care of your wealth. Have a nice weekend. My name is Zamzam Ahmed. Let's meet next time, next week, inshallah.